Hello, my name is Mary Albert, and I am an implementation specialist with Brown& Brown. We are the broker on behalf of your group. And what that means for you is that you do have an account management team that is dedicated to you pre-enrollment, post-enrollment. If you do have any questions that arise throughout this upcoming coverage period, you do have an account manager, and we will provide that information at the end of today's recording. Now, today's goal is to provide an overview of the benefits that are being offered to you so that you do feel confident in making your elections for this upcoming coverage period. The way you will enroll, this is an active enrollment, which means you are going to want to go into your Microsoft Forms that has been provided to you to sign up for your benefits. The deadline to sign up for benefits is going to be June 24th at 5 o'clock. Now, once your plan goes into effect, you can see it starts July 1st. It's going to go through the end of June of 2025. Now, I did mention that cutoff date of June 24th at 5 o'clock. Once that rolls around, you will be sealed or locked in with the benefits that you've elected until the end of June 2025. However, if you do experience a qualifying life event, and we have listed some examples of those here for you, if you get married, if you get divorced, if you have a child, it's going to be real important to reach out to your HR leader within 30 days of that event to see if coverage can be changed. This page here just includes great terminology that you'll hear me referencing today. Now, you are switching carriers to Aetna. So I'm going to go ahead and scroll in here. This is a real important page because this is the information that will help you create a member portal. By having a member portal created with whoever your medical carrier is going to help make your health journey throughout the policy year a much smoother one. Now, in this flip book, you can see that I'm hovering on this site that will take you direct to Aetna's website to create that member portal. You can create one once your plan goes into effect. Lots of great benefits. If you lose your ID card, you can find a replacement card. How to search for those in-network providers. Here's a great resource right here, this Nurse on Call. We've listed a phone number here for you as well so that you can have access in speaking to a registered nurse. Lots of great health and wellness resources. So I would definitely encourage you to take a moment to look at that. Look at this down here. You can earn up to $100 per year by completing some activities. Now, over here are the two medical plans that are being offered to you through Aetna. Aetna's the carrier. It's going to be real important to be mindful of the name of the network. And we have included the name of the network up here. You can see those listed up here at the top. If you call your doctor and say, I have Aetna, do you take my insurance? They could take a portion of your insurance, but be out of network. In order to drive those costs down, you would want to ask them, are you a participating provider in, and of course, mention the network that you've selected. So I'll go through what's the same and what's different on both of these plans. What is the same right here? If on either plan you elect and go to your annual physical, that includes your annual blood work or any preventative screening that's appropriate for your age and gender, it will be covered at 100% if that provider is in network. I just advise when you make that appointment to use that terminology, annual physical, preventative screening, so that it's coded correctly and you won't have to pay for that service. There's roughly two ways you'll pay for a service. You'll either see something that says copayment or deductible plus coinsurance. So I'm going to explain the difference. In order to help you select the plan that's best for you, you may want to ask yourself the question as to what your current benefits look like, what's working, perhaps what's not working, or do you have any procedures or treatments scheduled for this upcoming coverage period? By thinking that will help you make the best plan choice for yourself or for you and your family. So for example, if you were to seek out primary care physician, you can see on either one of these plans, it's a flat copayment. A copayment is a fixed flat dollar amount that you are expected to pay at the time of service. So you'll see urgent care, it's the same thing. It's a flat copay. Anytime you make a copayment, that tracks towards the out-of-pocket maximum. And as you can see, the out-of-pocket maximum, the first number here is the same if you sign up employee only, whereas the second number is if you're adding dependents. Now, you may see something that says deductible plus coinsurance. So what does that mean? If you were to seek out and have to stay in a hospital stay on either of these plans, going in network, so there's a difference in these two networks, you would be responsible to pay a negotiated, contracted, reduced rate because that facility has a contract with Aetna. So any money that you pay for a service like that tracks toward your deductible bucket. So I'll use the second plan as an example. They're the same on either plan. You may never hit your deductible within the calendar year because this plan, your deductible runs on a calendar year. And if you don't hit your deductible, that is okay. But if you hit your deductible, imagine a wall knocking down, you then go on to phase two. Phase two is called coinsurance. Coinsurance is a cost sharing between you and the insurance company. So if you then your bills came in for any service that's tracking towards your deductible, you then go into the coinsurance where you would now be responsible for paying 20% of that bill. Aetna would be responsible for 80%. Third phase is that worst case scenario, which is that out-of-pocket maximum that I mentioned earlier. So it's real important to note, you can go onto Aetna's website to search these two different networks to see if perhaps finding a provider that you may want to see is participating in either one of these networks. Now you do have prescription drug coverage on both of these plans. They run very similarly. If generic is in your best medical interest, you could talk to your doctor. Oftentimes that drives your costs down. And you can see that it depends on what tier your medication falls under would determine what amount of the copayment is that you're responsible for paying. When you get into a specialty medication, you're paying a percentage of that cost. Now, also another way to save money if you're on a monthly medication is having your provider, if they can, write it in a 90-day supply. It would save you a little bit of money there as well. Now, I mentioned the network and the different network names on both of these plans. If you step out of that network, you will have some coverage, but it's real important to note, I'm going to zoom out so you can see this, that these buckets of money, if you're on this first plan and you're adding you're paying for services that are being added to this out-of-pocket maximum or the deductible bucket, the moment you step out of the network, those buckets start over at 0. So they don't combine. So it is quite expensive to fill the in-network service buckets and then the out-of-network as well. In addition, as you can see, these out-of-network buckets are much larger. So it's going to cost a lot more money to be able to fill both. In addition, out-of-network providers and out-of-network facilities do not offer you that reduced negotiated contracted rate. So oftentimes their charges would be higher and you'd be responsible for that balance. It's important to note that if it is in your medical best interest to seek a doctor or care outside of the network, you do have an option on either of these plans. However, to drive those costs down when you can, staying in network is a great idea. And you can pause this recording and zoom in to see what the differences are in your biweekly deductions. Now, I did just mention those prescription drug coverages that you do have when you're using your insurance and going to an in-network pharmacy. You also can take advantage of programs such as GoodRx and Single Care if that route and using your insurance is a bit high. GoodRx and Single Care are free websites. You could type the name of a prescription into the site and it's going to show you the different pharmacies and what it costs in picking that prescription up. Oftentimes it drives the cost down. However, be mindful that if you take advantage of these programs, it doesn't combine with your insurance. So it doesn't track towards your deductible or your out of pocket, but it could be an option to save money. As well as different pharmacies offer different flat discounted programs. So I often say this is your skin in the game. Where you have that prescription filled is a good opportunity to save money. And down below here, I'll go ahead and zoom in, create a roadmap. Where will you go if you're not feeling well? I mentioned that Aetna has that registered nurse line. That's for free if you sign up with medical. Of course, going to your primary care doctor if you're not feeling well. Those are options that would drive your cost down. If you were to seek out an urgent care situation, it's important to know where those in-network urgent cares are. That would be at a higher cost. And of course, an emergency situation is going to be your highest cost, but minimally create that roadmap as to where those facilities are nearby you. Now you're also being offered dental coverage, and this is going to be through, you can see it here, Blue Cross Blue Shield of Arizona. Now we have included a website here. If you do get this flip book, you can click on the site or pause the recording and write that site down. There are two different plans or two different types of plans being offered to you. One is a DHMO and this one over here is a PPO. So we'll look at this DHMO separately. This is the network. This is a very straightforward plan in the sense of you can see if you need a particular procedure, there's a flat copay that is attached to particular procedures. It also includes orthodontic coverage, and you can see those listed here. It gives you a certain maximum amount to be able to use that benefit. This particular plan has a more narrow network of dentists. So if you don't have a dentist that you love and you want to take advantage of some of these straight copays, this could be a plan option for you. Whereas this plan over here gives you a little bit wider of a network. It has in and out of network coverage. However, all of these out of network percentages are only going to cover you at the reduced rate. So staying in network is always going to be your best option. The way this particular plan works, if you were to seek out any of the preventative procedures, staying in network, it covers you at 100%. If you were to need a filling or any of these basic procedures or major procedures, you're responsible to pay a one-time calendar year dental deductible, and you can see those listed up here. Once you make that dental deductible, staying in network, the plan covers you at a certain percentage. Out of network, again, they're only going to cover you the percentage of those rates. So those dentists might charge you more. They don't have a contract with this carrier. Now, the most you can have set aside, this plan will set aside to pay these allowable charges is $1,000. And be mindful that that is per person on your plan, and it replenishes every January 1st. So if you sign your children up for this plan, they as well would have that $1,000 set aside to pay their dental claims. You can pause and take a closer look at those premiums. Now you are being offered vision coverage through Aetna, and again, right here is going to be the greatest way for you to click and search for those in-network eye doctors. So we're going to go ahead and zoom in. By having your eyes examined, I learned this last year, they are able to tell more about your overall health than just your vision. They can see if you're pre-diabetic, have high cholesterol, high blood pressure, just by having your eyes examined. Now, when you do make that appointment, or if you make that appointment, I should say, let's imagine it's August 1st. It's a flat copay, $10, and you're eligible for your next exam the following August 2nd. It's 12 months plus 1 day. You can see you're eligible for lenses every 12 months. Frames, you're eligible for every 24 months, and contact lenses every 12 months. Now, if a doctor deems it medically necessary that you have to wear contacts, those would be covered in full. Now, with all vision coverage, you cannot use your eyeglass benefit and your contact benefit within the same year. You would want to alternate those. And I'll just share this advice with you. If you are seeking out at a facility and getting materials, glasses, contacts, and you hear them saying, we'll give you $65 off or $90 off, if you're listening to those coupons, it sounds great. Chances are you're out of your vision network. In order to drive your costs down and maximize this benefit, you're going to want to seek out not only your eye doctor appointment, but also getting these materials fulfilled at an in-network facility. These are the costs coming out of your paycheck. Now you are being offered short-term disability, and that's going to be through Lincoln Financial Group. Short-term disability is paycheck protection. If you become injured or ill and you're unable to work, if it is a covered claim, an allowable claim, it's going to pay you after a waiting period. You can see here of 14 days. On the 15th day, it would pay you 60% of your weekly salary. You can be on this short-term disability for up to 24 weeks. And this is great. Sometimes short-term disability plans have a pre-existing exclusion. Yours does not. And if you want to figure out what this would cost you out of your paycheck, you would definitely want to pause this recording and do some math down here so that you can calculate and understand what that would cost coming out of each paycheck. Now, you were also being offered basic life and accidental death and dismemberment coverage at no cost as well. If something were to happen to you while you were working for your company, somebody that you designate as a beneficiary would receive 1 times your annual salary, not to exceed $50,000. So now that you're in your open enrollment, when you're completing your Microsoft forms in this enrollment, it's going to be real important to designate that beneficiary who would receive To zoom in because there's some wonderful key players on this back page that we've listed for you. I'd like to highlight my teammate, Sarah Schmock. She is wonderful. She's included her information and her phone number for you. Sarah is very well versed in all of your benefits. So if you need additional questions answered, Sarah is a great resource. Now, it's important to be mindful of one thing. June 24th at 5 o'clock, those Microsoft forms are due. That's when your enrollment ends. Thank you so much and have a great day.